Hello everyone. Have you been diagnosed with a varicocele? Are you curious to know about the treatment options of varicocele? I am Dr. Santhosh Kumar, consultant at Craft Hospital, Kodungallur. I will be discussing today about varicocele and its diagnosis and the management options. So what exactly is a varicocele? It's basically enlargement of the veins that drain your testes. And as we all know, testis in its normal position inside the scrotum, the temperature inside testis is 2 degrees lower than the body temperature. And this temperature is suitable for the sperm production. And what happens in varicocele? Because of this dilatation of the enlargement of the veins, the blood is pulled around the testis. So the temperature of the testis rises, and which is again not suitable for sperm production. Also added to that, your oxidative stress level in and around the testis will be more, which will be again bad for the spermatogenesis itself. Now coming to what are the symptoms of varicocele. So many of the times you may not have any symptoms and will be diagnosing on clinical examination. But few times you may have symptoms of a pain or a dragging sensation in your scrotum area. And occasionally, like if the varicocele grade is very severe, you may feel it, the varicocele during your self-examination, you can feel it, and it typically feels like a bag of worm or a spaghetti appearance. So, and very rarely, if it is again a severe varicocele, it can be visible from outside, like you can see the veins, dilated veins from the outside itself. Now, mainly actually the diagnosis is on the clinical examination, like when we are examining. So that's how we get to know the diagnosis. And there is absolutely no alternative to clinical examination for a varicocele diagnosis. So this point I would like to emphasize again and again. Clinical examination is the method to diagnose varicocele and also grading varicocele. So we grade it like 4 grades there depending on the clinical examination we grade it. Grade 0 is the least severe one and grade 3 is the most severe form of varicocele. Occasionally we advise a scrotal Doppler. This is not for the diagnosis per se, but to counsel the patient regarding the management options. Now coming to management, we have basically medical management and surgical management. Surgical management, we basically, the management options depend on few factors like how is the grade of varicocele, whether it is a severe grade or a mild grade, which is grade 0, grade 1. How is your semen parameters, whether it has affected your semen parameters, and your previous fertility treatment and pregnancy history, like have you been gone through in multiple cycles of failed IVF or repeated miscarriages. In those scenarios, we may advise a surgical correction of varicocele, which is a very, like we give around 1 centimeter incision in your inguinal area and just tie those dilated veins. And medical management, like in less severe forms, if the semen parameters is okay, then in those cases we advise some antioxidant medicines for 3 to 4 months. Then again assess your semen parameters and proceed. And just at the end, I would like to tell few words about lifestyle modification or changes. One thing that will always be helpful in case of varicocele is quitting smoking. So if you are smoking, you should quit smoking. That's always helpful. And a balanced, healthy diet with lots of vegetable and vitamin C containing fruits will be helpful. And apart from this, just try to avoid constipation, and that's the only thing that may be beneficial. So I think this information is helpful for you, and you are much much aware of varicocele now. Thank you all.